Hi there everybody, I'm James Carolyn, a massage therapist here at the Wardegrave Clinic, and I'm just in between clients right now, and I just want to talk to you about one of my main passions, which is massage. And we all enjoy a good massage, but there are times when massage may not necessarily be the right option, or as therapists we may have to adjust our technique or avoid certain areas based on the condition that you may have. So those are known as contraindications in our industry, and those contraindications are divided into certain categories. So the main categories are total contraindications, local contraindications, and medical approval contraindications. So a medical approval contraindication requires medical consent before a treatment can go ahead. A local contraindication is a condition on a part of the body that we avoid. And the last one is a total contraindication, is where we completely avoid treating until that particular condition has subsided. Okay, so I'm just going to go through some of those right now with you. I'm going to start off with the total contraindications, and then we're going to move on to the other categories. Okay, so the first category, first conditions are any contagious or infectious skin conditions and diseases. Okay, so examples of that are scabies, impetigo, ringworm, tuberculosis, shingles, and measles. There's a risk there of cross-infection and passing condition on to the therapist, and also to any other clients that the therapist may treat. The next one is under the influence of alcohol and drugs. So being with the effects of massage on the circulatory system, that speeds up the effects of the alcohol and drugs that you may have in the system. So if let's say for example, if you've had like a beer before having a massage treatment, that's the effects of that beer, will be a lot stronger as you come off the table. And if you potentially have to get into a car and then drive off, that's going to be a big risk as well. So so that's never a good idea before having a massage. So no recreational drugs or alcohol before massage. Neuritis. So neuritis is an inflammation of a nerve. So I don't think anyone would really want a massage, when you have neuritis. I mean, that would just be too painful to touch. So any condition where you feel like an area is just too painful to touch, just don't book that in. Next one is having a fever or a flu. Yeah, that could also be passed on to the therapist as well, and that means that therapist may not be able to work until that condition has been subsided as well. And so I'm going to go on to local contraindications. So again, that local contraindication is an area of the body which cannot be touched because we don't want to aggravate that condition, or we don't want that condition to be passed on to the therapist. So an example of that is areas of septic foci, which is an example is boils, verrucas, athlete's foot. Yeah, there's a danger there of spreading an infection. So normally, if somebody comes in with that condition, I normally just cover the area, make sure that any area of the work surface here that I'm working with that's been touched gets changed straight away, so there's no danger of cross-infection. The abdomen during the first 3 months of pregnancy. That increases the risk of miscarriage in later pregnancy. That's fine, just using gentle pressure. And the abdomen during the first 3 days of menstruation. I mean, most of the time, very few people have abdominal massages, but it's also good to know if it is recommended to have an abdominal massage. I always tend to ask my female clients that. Varicose veins. Yeah, there's a risk of varicose veins bursting, so that's never a good idea. So I tend to most varicose veins that I've seen are from the foot all the way up to the knee. So where I see varicose veins, I just tend to work above that area. Areas of undiagnosed pain. Yeah, I tend to ask my clients to see the doctor to get a diagnosis before I do anything with that. And areas of inflammation and pain. Yeah, any areas of inflammation and pain. Let's say where the skin is swollen, red, painful. Yep. Okay, so that's an area where if you see like an area where there's a cut or a bruise, massaging over that area, it's just going to aggravate the situation. So I tend to avoid that area. Great. Okay, so I'm going to move on to another condition, which requires medical approval. Actually, I think for some of these conditions here, I like to refer out as well. So I have here cancer. So for me personally, I'm not specifically trained to deal with cancer clients. So I tend to refer them on to other practitioners. But whether even if you have had even if you are a therapist that deals with cancer patients, I'm sure you also have to get medical approval. Conditions like osteoporosis. So that's a brittle bone condition. So with me, once I do get medical approval, I start off with very gentle pressure and gradually build up and work with my clients' needs, because you don't want to damage bones, especially under your care. Epilepsy. That may overstimulate a client to a point where they have more fits. So it's always good to get medical approval before you do so. And I think with epilepsy, if a client tells me that they have epilepsy before a treatment happens, I much prefer to work with them on the floor instead of working with them on the table, only because if they do have a seizure, then they're a lot safer, so they're not going to fall off the table. Yeah, I mean, this is I think this was written quite a while ago, but sometimes I don't think I'd get medical approval for this. If they have asthma, I just make sure that they have their inhaler with them, just so if anything happens, then at least they have like a safety measure there. Diabetes. Again, because of the effect of the circulatory system, what it has on the effects of like feeding the tissues and what have you, it may affect a person with diabetes like they've been exercising. So it's always a good idea that they have like a sugary drink with them and some insulin with them, just to be on the safe side. Okay, so those are most of the contraindications that tend to be presented in clinic. I hope this has been helpful to you. If you have any further questions, please do get in touch. My number is 07593 108 702. If you want to have a look at the Waldegrave Clinic website, that's www.waldegraveclinic.co.uk. If you want to look at my website and see the treatments that I do, that's www.maxstrengthholistics.co.uk. Until next time, enjoy your time away from work, and I look forward to seeing you here at the clinic at some point soon. Until next time, take care now. Bye.